And good afternoon, everybody. This is Art Shed. It's time for the show. It's the Shed Group, folks. It's MedicareHelpGuys.com. MedicareHelpGuys.com, folks. What do we do? Well, if you mosey on over to the website, you'll learn that we can get you up to $500,000 for healthcare spending during retirement. What are you going to use this money for? Well, you're going to use it for Medicare purposes. You're going to use it for long term care issues that possibly come up. You're going to use this for other things along the way. The best part is the help that you're going to receive along the way, provided by us, the Medicare Help Guys. We're going to show you how this entire retirement healthcare system works. Oh my God. Sounds like a novel approach, doesn't it? All we require that you do is set up yourself a free consultation. Once you got your consultation booked, and guess what? That could be over the phone, it could be in person, or it could be a Zoom meeting. We don't necessarily care, right? However you wish to do it. But if you do the consultation, we're going to tell you to take the quiz. Once you take the quiz, we're going to be able to determine where you're going to land. And I'm here to inform you, for some people, you will not qualify. Okay. And you will not be able to qualify because you have runaway chronic conditions that are out of control. You will not be able to survive underwriting. Okay. We'll let you know where you'll land. Now, for those people who can survive underwriting, you can get up to $500,000 worth of benefit that you can use for Medicare purposes or for long-term care issues. It's important that you know that healthcare during retirement isn't just Medicare. Okay. We're here to help you figure all this stuff out. All right. So that's what we do. So get your consultation today. Now, look, we want to spend a little bit of time today talking about this Wall Street Journal article that appeared earlier this month. I also get people who come to meetings with me and they come in hand with articles like the Wall Street Journal that are talking about the same thing. The title of this article is about the sickest patients are fleeing private Medicare plans, costing taxpayers billions. All right. The subtitle, Medicare Advantage patients in the last year of life were far likely to switch to traditional Medicare, shifting costs from insurers. In other words, shifting costs from the insurance company to the taxpayer. That's what they're saying. Okay. And all of this is because of the Medicare Advantage plan. I hear these conversations all the time. I have people who come to my meetings and they will say, "Hey, I've been told to stay away from Medicare Advantage. It's a bad thing, right?" No, it's not. But you need to understand what you're getting. Okay, it's not a Medicare supplement. It's a Medicare Advantage. It's a copay system. In most cases, the Medicare supplement, you pay a pretty hefty premium, and you don't pay anything further. Okay, it's two different systems. You have to understand how these two systems work. But most people want to paint the picture, the article in Wall Street Journal as well. They want to paint the picture that Medicare Advantage is just so bad for the American people. Well, I'm here to help you and first of all tell you that that's not entirely correct. If you understand what you're getting, you can plan accordingly. I'm going to say that again. If you understand what you're getting, you can plan accordingly. Okay. So when you look at this story and it lays out five individuals, they got some real numbers in here for us to take a look at. I'm not going to dive into all this because at the end of the day, folks, it's a pretty lengthy article. Okay. Pretty lengthy. I mean, this is probably one of the longest Wall Street Journal articles I've read this year. Okay. But once you read it, there are four stories that set up, and I'm going to give you the highlights of these stories. But then, after I give you the highlight of these stories, you need to understand the anatomy of getting care. If you can understand the anatomy of getting care, you're well on your way to understanding how this system works. Okay. All right. So let's deal with the four individuals. The first individual is a lady by the name Pat Green. In her late 70s, she suffers a stroke. She's in a skilled nursing facility for a period of 30 days. She's told by the insurance company that she could benefit from going home, getting some skilled services there, in the way of physical therapy, some occupational therapy, and then maybe even some aid and attendant services. Okay. All right. Now, family thinks that this is, not a good thing. They've also been told by the skilled nursing facility that they can move to traditional Medicare. And with traditional Medicare, she can continue with the skilled care that she needs. Okay. Okay. And what's her issue? She's having trouble getting in and out of bed and transferring. Keep that in mind because that's important information to know. All right. The next person is Joe Smoltz. Suffered a car accident, had a traumatic brain injury, spent a couple weeks in the hospital, then was transferred to a skilled nursing facility. The skilled nursing facility made the decision that, this person could probably stand to use some rehab as opposed to some subacute care. Right. The plan, I do believe it's Anthem's plan, they decided that they did not want to pay for the rehabilitation. Okay. Now, the family consults with a consultant. Interesting, right? The consultant says go back to traditional Medicare, and a traditional Medicare will allow for your loved one to stay in the skilled nursing facility or go to the rehabilitation facility. Okay, so that's what the family does. The family um, moves, and it's noted that he stays in this skilled nursing facility that was recommended for a period of 2 months after the consultation and the switch back to traditional Medicare. All right, the third person. This is Miss Agnes Smirnoff. She's 98 years old. Her daughter, Miss Tatiana Fossey, uh, is the person that's probably the POA in the family, right? But Miss Smirnoff suffers a broken femur at 98 years old. She's hospitalized. She's receiving what they refer to as acute or subacute care at a rehab facility for a period of 19 days. She's received a letter from the Medicare Advantage plan saying this person can benefit from going home and receiving some more physical therapy there while getting some aid and attendant services. Okay. All right. The family talks with the skilled nursing facility. The skilled nursing facility says, what? Hey, this person could benefit from going back to original Medicare. If they go back to original Medicare, they can stay at the skilled nursing facility longer, right? This person, Miss Fossey, after going through three appeals processes, right? She loses on the fourth appeal. She gets three of them, but she loses the fourth. They make the transition to go to traditional Medicare. Now, there is a gap of time that the Medicare Advantage plan said that they were going to stop paying, right, to the time where the traditional Medicare product kicked in. And during that period of time, the family spent $14,000. Okay. It's said that the family spent, the taxpayer spent $55,000 over a 2 month period after going back to traditional Medicare for this individual's care. We don't know what happened to her, but what is she having problems with? She's having problems walking. Keep that in mind. The last person is a Janet Birch. She's 80 years old. She suffered a stroke. They tell us off the bat she's having trouble walking. Okay. She was informed by her Medicare Advantage care company that they were not going to pay for skilled nursing at a facility. Okay. She could benefit from getting this care at home, getting physical therapy, some occupational therapy, and an aid and attendant at home as opposed to being in a facility. The family talks to the agent. because apparently, and I don't know how it worked, but apparently the issue of traditional Medicare comes up, right? If I had to guess, this was probably put on the mind of individuals at the hospital. If she had traditional care, she can go to a skilled nursing facility. Okay. Medicare will pay for it. Okay. That's what they're telling. The agent says, sure, I can move you back to traditional Medicare, but it will happen at the beginning of the year. Okay. If it happens at the beginning of the year, we could then look at a Medicare supplement, but you probably aren't going to be approved for it. Okay. And if you are approved for it, you are going to pay a much higher premium. Okay. Family doesn't like that. So they elect, it looks like, to stay in their Medicare Advantage plan, but it does say that there are family members that are helping her at home, and they spent somewhere in the neighborhood of $5,000 for some additional physical therapy and some home health aid services. Okay, so those are our four individuals. One's having trouble, two are having trouble walking, one's having trouble transferring, right? And getting in and out of bed, right? And the other has suffered a major brain injury. And keep in mind, the article starts by telling us that patients in the last year of their life are far likely to switch to traditional Medicare. So we're assuming some things here that these individuals are in the last year of their life. Okay. Hasty generalization, but we just are reading the story, how it's presented itself. Okay. At this point, I think I need to make sure that you understand the anatomy of how care works in the Medicare system. Okay. Everybody's familiar with, you have this red, white, and blue card, and on that red, white, and blue card, it's broken into two parts. There's part A and then there's part B. When it comes to part A services, right, these services are handled as inpatient in a hospital, 24 hours of care or better. All right. If it's 24 hours or more, then it's probably going to be an inpatient setting, right? Where you can get skilled services at the acute level in a hospital facility. Okay. All right. So let's dress this up. I'm going to say this once and I'll repeat it a couple times. We have an emergent issue that happens. Let's say that an individual has a stroke. Emergent issue. It requires hospitalization. Medicare tells us that if you're getting hospital care, it's acute care. Inpatient hospitalization is acute care. Okay. Why do they call it acute care? Well, we have an emergent issue. You end up at a hospital to receive acute care, which is, I guess you would say, the terminology is, it's acute because we don't want this person staying in the hospital that long, right? So these are acute. The system isn't designed for a person to be there for extended periods of time. Now, you can look at the Medicare document in the Part A side. Sure, you can get, call it 90 days or 100 days of skilled nursing. You can also get 150 days in a hospital setting. Okay, right. But that doesn't happen that often. Although I can say that people who had COVID a few years ago, they stayed a lot longer than they anticipated too. So it's out there, but it still registers as acute care. How long is it acute? It's acute until it's stabilized. Okay. So you have an emergent issue that requires acute care. How long does it acute? It's acute until it's stabilized. What happens after it's stabilized? Well, we start looking at the subacute issues. Okay. So we have a person that has a stroke. Okay. They go to a hospital to get acute care. Okay. While there, they're working on the reasons for the stroke, right? They get it stabilized. We now turn our attention to the subacute issues. What are the subacute issues? Well, a person who has a stroke probably will have some deficiencies when it comes to motor function, right? Probably will need some speech therapy, right? There will be things that aren't necessarily the stroke, but are related to the stroke that will require some attention. And at the subacute level, they tell us that if it's subacute, folks, it doesn't need to happen at a hospital. It can happen better at a subacute facility or a skilled nursing facility. Okay. All right. So understand where we are, right? Emergent issue, the stroke. Where are we going? We're going to the hospital. For what? Acute care. How long is it acute care? Until it's stabilized. Once it's stabilized, what are we looking at? We're looking at acute care issues that may result from the emergent problem. Okay. So if you're at a skilled nursing facility getting subacute care, here's what you need to know. When you're looking at a Medicare Advantage plan, they look every week. In certain cases, multiple times during the week to check in on how is this person progressing. And I generally tell members, look, there are three outcomes there, right? One, person is progressing on schedule. That's what the insurance company wants to hear. If that's the case, more likely is the case that care will continue, right? Two, person is ahead of schedule. If you're ahead of schedule, they're probably going to say this person can probably benefit from getting care at home. They're ahead of schedule. Or three, person is behind schedule. Well, why are they behind schedule? Well, when you start looking at the case notes, they could be behind schedule because they don't want to do physical therapy 3 times a day. Well, if that's the case, guess what? The plan says, well, that person could probably benefit from getting skilled care at home with the emphasis on physical therapy. Okay. All right. Option one is the one that everyone wants, where care will continue. But we may land in category 2 or category 3. Keep that in mind. So, the notes and the information that they're putting in the chart are also very important, right? As we're trying to establish the facts. Why are the facts important? Because the insurance company is looking really, every week. In certain cases, multiple times during the week. Versus if you have a Medicare supplement, okay? Medicare may look once every 60 days, if that. In fact, Medicare, when you look at the audits that take place, look at the Medicare system. They tell you that they may audit a facility, a skilled nursing facility. Now, keep in mind, there are over like 15 to like 20,000 skilled nursing facilities out there, right? The CMS population employees is like 6,700 people. They also contract out to some third parties in order to do the audits for them, right? So, do they have the manpower to look every week? No, they don't. I just told you. They may do an audit once every 6 to 15, or sorry, 9 to 16, 9 to 15 months. Okay. Whereas, take, for example, United Healthcare, they got a dedicated, group of people, some 450,000 people. They have a dedicated team that looks into Medicare Advantage issues, right? That's like 100,000 people, right? And then of the 100,000 people, you probably have like close to 50,000 of them who handle the claims issues. So, are they better suited to handle claims issues? Yes, they are better suited than original Medicare. Why is that? Because original Medicare never promised you that they were going to manage care. They just promised you that there would be a benefit when you needed care. That's the big difference. Okay. I'm closing. I'm getting to the end, but I just want to make sure you understand this last and most important point. When you look at what's happening at the skilled nursing facility, when you hear these conversations, when people tell you they're kicking people out, they shouldn't do this, I want you to think about this point that I'm about to make. When you signed up for Medicare, Your Social Security notification told you that Medicare will cover skilled care, nursing care, all the different things that Medicare will cover. Then it told you that Medicare doesn't cover long term care issues. Make sure you get some type of plan for that purpose. I don't know if you read it or not, but it's there. Okay. So, what is a long term care issue? I think it's important that we understand what the definition is. So, when you look at the definition of a long term care issue, you would learn that it's any type of insurance that helps cover costs for long term care for chronic conditions or disabilities. Now, here's the setup. Here's what you need to know. When you're thinking about these individuals who are in these skilled nursing settings, what becomes the primary issue? They're there, they're getting the skilled care. The insurance company says, no, the person can benefit from going home. Remember the four people in the article, all right? One of them had a traumatic brain injury, okay? And the other had a broken femur. She was having trouble walking. You had one individual who was having trouble transferring from the bedside to any other place. Maybe it was to the bathroom, or maybe to a chair, or to a couch, or something. They needed some assistance. Ask yourself this question: the assistance that they need, is it care that is needed by a nurse? Probably not. Is it care that is needed by a doctor? Probably not. If you're needing help walking, is it aid and attendant care? Yes, it is. That's why they're telling the individual that they need to go home. Now, if you don't have a long term care contract in place, right? How are you going to do this if you have to go home? And this is the part where the family looks at it and they're like, you know what, we can't do this. That's because they never planned for this. Okay. Okay. So just keep in mind when you're in that skilled nursing setting, and the issue that you need assistance with is more in the nature of those 7 ADLs, which you also need to know. These are issues or areas that make up long term care issues. Okay. If you need help bathing, showering, dressing, getting in and out of bed, right? Or to a chair, walking, or using a toilet or eating, these are the ADLs that make up long term care, or what they refer to as chronic conditions. Okay. That's what you're getting at these facilities. The issue has become chronic. Okay. How do we define chronic? And I swear I'm coming to the end here, but you need to understand this. This is important that you understand. How do you define a chronic issue? Think about it this way. Remember the setup. We had an emergent issue. Person had a stroke. Okay. They ended up in a hospital, right? Ended up in a hospital to get what? Acute care for the stroke, right? Once we get the stroke stabilized, is it still acute? Probably not. It probably moves to a subacute status. And the subacute status, we don't need to have that at a hospital. We can do that at a skilled nursing facility or rehab rehab facility, right? Okay. When do we move from skilled nursing to chronic? Here's what you need to understand. Can we get this person back to the condition that they were in before they landed in the hospital with the emergent issue? I don't know. Okay. If we can, great, right? But if we can't, this is where the hospital, they start throwing around the term your baseline. So your original baseline before the stroke is what they're trying to do. But if they can't get you back to that original baseline, then we're establishing a new baseline. And it's at that point that we have a chronic condition. And that chronic condition, ladies and gentlemen, isn't handled at a subacute facility. That's the anatomy of care. You go from emergent to acute to subacute to possibility of a chronic condition. And Medicare doesn't pay for chronic conditions at the Part A level. It's at the Part B level. That's your plan. That's what you signed up for, paying taxes and getting Medicare, Part A and Part B. So, but you're not alone. There are a number of people who do not have a long-term care policy. 70 million people that make up the Medicare space, less than 8%? Less than 8% have some form of long-term care. And when you don't have long-term care, right, the family then becomes responsible for providing care. The family also is stretched because, we have two individuals, if you're in the what we call the nuclear family, right? Two individuals now that have to work, right? Who may have children who have different events going on. The sandwich generation, we start hearing these terms, sandwich generation, right? Understand, in most cases, they can't take on that stress either. So, trying to get this done at a skilled nursing facility is apt for the family as well. But keep in mind, it's really a long-term care issue. Now, we could go into the reasons why a skilled nursing facility would put so much stress on going back to original Medicare. I can do that, but I'm not going to do that in this video. I'll make a follow-up to that because it's important that you understand what's happening on the other side too. Okay. They want to take you to traditional Medicare and have the skilled nursing facility pay for services. That's interesting because ultimately what they're saying is that, and if you don't have a long-term care policy, right, we can finagle a way in order to get the skilled nursing facility to pay for this care, or in order to get the taxpayer to pay for this care. That's what they're saying. Okay, so look, there's some other parts of the article that I thought were entertaining because factually just wasn't true, and factually they were just overselling the issue. I mean, for example, they talk about between 2016 to 2022, some 300,000 people moved back to traditional Medicare, and of course they're dressing this story up as if it's a three-alarm fire, and people need to stay away from Medicare Advantage, right? Look, that's like 0.07%. I'm taking the number of people in the Medicare space, which is 70 million. Then I'm saying the number of people within that universe who have a Medicare Advantage plan, which is roughly about 40 million. Okay. All right. Take that 40 million. And then you got 300,000 people who have a Medicare Advantage plan who are going back to original Medicare, 0.07%. So it's not a three-alarm fire. Okay. It's not the three-alarm fire they're dressing it up to be. But it is happening. But it's happening for a reason. And we'll talk about the skilled nursing reasons in a follow-up video. You need to understand that. But you also need to understand that if you are a member of the Shed Group, we planned for that eventuality. And if you can get up to $500,000 in order to help you in this particular case, guess what? We're suited to take on the possibility of needing care at home. Anyway, like and subscribe. Like and subscribe. I could tell you a lot of stories. This has been a very entertaining AEP. Okay. Just understanding how people see care is interesting. I can tell you about that in another video too. But anyway, like and subscribe. Tell your friends about us. Right? Because there's a lot you need to understand. And I'm here, look, I don't anticipate that you're going to understand everything. but I do anticipate that you're going to trust me to get you through this system. That's all I have to say, folks. Have a good evening.